next keynote is from Wes Streeting MP, Shadow Secretary of State for Health and Social Care. Please welcome to the stage the host of this session, Lord Victor Adebowale, the Chair of NHS Confederation.
Thank you, it's me again. Oh, not him again. Yeah, here I am. Something that we're hearing a lot about today is the future, about the NHS and its future, what fantastic work that you're already doing to make that future possible. Much of it's driven by people in this room. And as we move towards the NHS's 75th anniversary next month, there's an important opportunity to reflect on the history of our National Health Service, its founding principles. We've had some of that today. How our society can work with it, needed, expected, change the way society engages with the health and social care system. We're also, of course, moving close to the next general election. And we're seeing a lot more reflection on this in the media and indeed in our national conversations. We all want to understand what a potential Labour government would mean for the NHS and wider health systems. We're delighted to have Wes here with us today to speak to health leaders direct about what he hopes things will look like. So we'll ask the Shadow Secretary of State a few questions afterwards. And so if you'd like to join me in giving Wes Streeting a very warm welcome. Wes Streeting, please.
Thank you very much for that introduction, although I have to say I feel royally stitched up by Matthew Taylor, who's done the kind of walking, talking act that politicians aspire to as sort of god-tier speech status, even if, as you heard, we don't always pull it off. So despite the temptation to throw my speech over my shoulder and ad-lib, there's no surefire better way of me being fired from the Shadow Cabinet tomorrow than going off script. So bear with me. And Matthew's also told me, because he's not uncritical, my speech is far too political. So apologies in advance for that too. But I do think politics is part of the problem at the moment, and I'm going to maybe stretch the boundaries of your cynicism by gently suggesting that politics might have something to do with the solutions too. Or I won't push my luck too far in getting you dancing to the aisles at the thought of politics being part of the assistance for the NHS, but we'll see how we do. There's a serious point here, which is even if the NHS weren't in the midst of the worst crisis in its history, which it objectively is, and even if the public finances weren't in a terrible mess, which they are, my argument would still be that we need to be talking about how we build an NHS that's fit for the future, equipped to deal with the health needs and epidemiology of the Britain of 2048, not 1948. But the depth of the crisis in our NHS and the state of the economy makes the conversation about change and modernisation even more urgent and vital. You don't need an extended diagnosis of the morbid symptoms from me. You are faced with the consequences of crisis every day. Instead, I want to use this time to offer some hope, light at the end of the tunnel. Today, I want to be talking about some of the amazing opportunities available to the NHS now and in the coming years. The revolution that is taking place in medical science, technology, and data that has the potential to transform our healthcare. Because there is no reason why we, in Britain, should not be leading the rest of the world in this field. But too often it feels as if the NHS is stuck in the analogue age. There are a number of reasons for this, of course, but the main one is failure from the top. A government that cannot effectively reform the health service because it is unwilling, unable, and too distracted to do so. The chaos in the Conservative Party makes plans for long-term change impossible. I've been Shadow Health Secretary for 18 months, and I've faced 4 different health secretaries in the past year alone, although, to be fair, 2 of them have been called Steve Barclay. But again, there is a serious point, which is this. How can NHS leaders stabilise a system and build a path to a better future when you are constantly firefighting or dealing with instability, uncertainty, and bad political leadership. The junior doctors' strike this week is likely to be one of the most disruptive in the history of the NHS. More than 500,000 patients have already seen their operations or appointments cancelled as a result of industrial action. Waiting lists that should be falling by now continue to rise. Yet the government continues its disastrous approach of refusing to even negotiate with NHS staff, an approach which has failed. It may suit the Conservatives to blame rising waiting lists on strikes, but it doesn't suit the NHS and it doesn't suit patients. So my message to the Prime Minister is simple. Take responsibility, get around the table with junior doctors yourself and negotiate. Because if Rishi Sunak can spare an hour to negotiate with Boris Johnson over the honours list, he can sit down with junior doctors and negotiate an end to these strikes. And yes, this is partly about pay. I know for junior doctors, this is about career progression too. That is why the NHS Workforce Plan needs publishing urgently. But I was struck last week by comments from Tom Rokes, the Vice President of the Royal College of Radiologists. He said the single change that would help most to retain doctors is better IT. Now, whether that's the view of everyone is not quite the central issue. The point he makes is a serious one, which is this. For every patient he sees, he says he has to enter 7 passwords just to get the information he needs, every time. He said the technology on his phone makes his life easier, but IT at work makes his life more complicated. Our health service is being held back by creaking, outdated technology. You know it, frontline staff know it, patients know it. It's time for an upgrade. In 2018, the Conservatives banned the purchasing of new fax machines. 5 years on, 600 of these slow, inefficient machines are still in use across dozens of trusts. In 2013, the then Health Secretary pledged to make the NHS paperless by 2018. And 4 years later, he admitted he was, and I quote, quite relieved that most people seem to have forgotten that I made that promise. Jeremy Hunt's reward was promotion to Foreign Secretary, and today we can all rest easy knowing that this expert in failure is only in charge of the Treasury. Meanwhile, and again there is a serious point, meanwhile, hours of staff time is wasted, patients experience worse care, and taxpayers' money is effectively chucked down the drain. And I'll give another example. Zabir Ahmed, who's Labour's candidate in Glasgow South West at the next general election, also happens to be a surgeon. And he told me an all too familiar story about his frustration of accessing a PDF file with his patient's notes, only to find they'd been scanned in the wrong order, which meant he had to print them out, reorganise them to get the information he needed. Multiply the time lost by him and others, and it's not hard to see the volume of lost time across the NHS. Staff time and public money, both of which are in short supply. And as Labour's research reveals today, almost 80% of trusts are still running on pagers, with 80,000 of them in use across England. And this is technology that is so obsolete that there is only one supplier of pagers left in the world. I had to check that because I didn't believe it. One supplier of pager. Imagine how much they're going to like the next bit of this speech. Because a new pager today costs up to £400. At last count, 1 in 10 pagers that are still in use across the world is owned by the NHS. And I'm sorry, but this is not what an NHS fit for the future looks like. So it's a bit rich for Rishi Sunak to promise to make Britain a world leader in AI when he can't even axe the fax or purge the pager. And these failures may sound trivial, but this is the low-hanging fruit. If they can't do the basics, what chance is there to seize the opportunities that exist today but aren't being taken? New technology is available right now, but not on the NHS. The coming years will see innovations that will change the face of healthcare. But how long will it be before patients here in Britain see the benefits? There are now tools which can map radiation therapy onto cancer cells, avoiding organs more precisely than an oncologist working alone. And it does it in seconds rather than the hour that it takes a doctor. This is the standard technology used across the United States. But just 1 in 3 radiotherapy planning centres in England use this technology. There are between 1 and 2 million mammograms done across the UK each year. 96% will not find cancer, but those women are currently left in the dark for weeks or even months waiting for the results. Why the hold-up? Because 2 clinicians are required to check them, and there is a workforce crisis. But AI can rule out cancer-free scans in seconds, getting patients their results faster and freeing up clinicians to focus on the tests displaying abnormalities. This has been rolled out across Hungary since 2021, but not across the NHS. AI can help interpret chest X-rays, saving 15% of a radiologist's workload. When combined with interpretation by a consultant radiologist, it can reduce missed lung cancer cases by 60%, yet to be fully adopted by the NHS. And I've said before that the future of the health service must see more care taking place in the community, reducing the burden on hospitals and allowing patients to receive healthcare from the comfort of their own home. But slow adoption of technology is working against that. At-home tests for kidney disease that use smartphone apps can cut down on unnecessary trips to the GP and hospital while helping to detect problems earlier. So why are they only available to half of NHS patients? Clinical trials can now identify ideal candidates using genomics, but trials can't recruit enough people to take part. Not because patients aren't willing to help, especially developing new treatments. We saw during the pandemic that the will is there, when more than 500,000 people signed up to the vaccines trials registry. It's because companies running trials can't access basic data, like how old patients are or even whether they're still alive. They have to work up agreements with each trust rather than a single agreement with the whole of the NHS. Patients are missing out on new medicines, life sciences is losing investment, and the NHS loses revenue. There is a huge cost of inaction. Yes, the workforce crisis in the NHS can be tackled by getting more people in. That's why Labour is committed to double medical school places and train 10,000 more nurses and midwives, paid for by abolishing the non-dom tax status, as well as focusing on wider workforce planning. But that will take years. The technology that exists today can instantly free up staff, make their working lives more bearable so they stay in the service, and deliver better, faster care for patients at the same time. The think tank IPPR estimates that automation could be worth £12.5 billion to the NHS in staff time freed up and better productivity. And at a time when the cupboard is bare because the Conservatives crashed the economy, this is a lifeline the health service cannot afford to miss. Of course, there are those that argue that the NHS itself is outdated, that the values of a universal public service free at the point of use is past its sell-by date. The irony is that as a universal, single-payer service, the NHS ought to be the best-placed healthcare system in the world to take advantage of changing technology and medicines, one that can give the life sciences sector access to a diverse and large population to trial new technologies and treatments, one that ought to be able to negotiate a good deal on price with a good offer to purchase at scale in return, one that should give our patients access to cutting-edge breakthroughs in treatment and care. Clem Attlee and Nye Bevan would have had no idea about any of this when they built the NHS 75 years ago. But the values on which they built it, universal healthcare, free at the point of need, publicly funded, are more relevant today than they were in 1945. And they give the NHS a huge advantage. The problem is, though, that Bevan and Attlee would also recognise too much of the NHS today. Nye Bevan said the NHS always needs to be changing, improving, but over the last 13 years it's stalled. Why? Because the Conservatives can never effectively reform the NHS. They opposed its creation because it was built on values they simply do not share. Just look at what they say once they're out of the door of the Department of Health. Both Matt Hancock and Sajid Javid called for patients to be charged for appointments months after leaving the Department of Health. In office, Conservatives are paralysed by fear because they know the public will never support a health service built on their values. And the story of every Conservative government is the same: managed decline and neglect of the NHS, the health service left to wither on the vine, necessary reforms ducked. So as ever, it will be left to a Labour government to renew the health service and make it fit for the future. Just as only Nixon could go to China, only Labour can reform the NHS. In his speech last month, Keir Starmer made it the mission of the next Labour government to build an NHS fit for the future. He committed us to shifting the health service out of the analogue age and into the digital. Here's how we'll do it. A single front door for innovators. No more shopping products or trials to each and every NHS trust. Where they can help, we will hold the door open and usher them through. In procurement, the NHS should identify the goods and services that should be purchased at scale and buy them at the discount rate. We will cut out unnecessary bureaucracy to stop new technology being constantly re-evaluated for years while the world moves on. In clinical trials, every trust will operate through a standard system, so the number of contracts needed is minimised and the administrative burden and duplication is eased for all involved. And we will make proper use of the NHS app. I was blown away when I visited a medical technology conference in Israel last year. I think they're about 10 years ahead of us, in all honesty. Ambulances use cameras and mobile phone apps to speak to patients and improve response times. Tracking of ambulances mean that patients are greeted on arrival at hospital by the appropriate healthcare professional. When I showed the NHS app to people at the conference, they laughed. It's got 30 million users. It's time to use it properly. Every patient should be able to see their medical records through the app. Patients should be able to use it to book appointments, order repeat prescriptions, and link to appropriate self-referral routes. When patients reach an age at which they should be screened or need a checkup, the app should tell them and ping them. If you're eligible for a clinical trial, the app should tell you, and you should be able to enroll through it. That's what we can do centrally, but I know we will not see the change that's needed unless it is the mission of NHS leaders at every level too. Too often I hear that it's easier to say no to change in the NHS than it is to say yes. And that really worries me. To make the NHS fit for the future, it will have to change. The change will have to be deep and fundamental, not just a few more doctors and nurses here, a bit more funding there. Serious reform and modernisation, a different way of delivering care for patients out of the hospital and into the community, from a service focused on treating sickness to one that prevents ill health, from analogue to digital. And throughout its history, the NHS has always changed, adapted and pioneered. It's rooted in the DNA of the NHS. And look at what can be achieved when the NHS says yes to change. The first mass immunisation programme in 1958, virtually eradicating polio and diphtheria. In 1968, the first heart transplant. In 1978, the first test tube baby, bringing hope to childless couples. In 1998, the introduction of NHS Direct, healthcare advice available to all 24/7 for the first time. In 2000, NHS walk-in centres. In 2009, free health checks for over 40s. In 2010, it was a British pensioner, Kenneth Crocker, who became the world's first patient to have heart surgery using a fully remote-controlled robotic arm. In 2019, the world's first gene therapy operation for common cause of sight loss, carried out by researchers in Oxford. This isn't about changing the principles the NHS was built upon. Rather, it must change to protect those principles and to deliver for patients once again. And look, I'll be upfront about this. When I talk about reform, I can sometimes hear the shivers running down a million spines of the NHS workforce. And I do understand why, believe me. You've had Andrew Lansley, whose 2012 Act has left much of the health service with post-traumatic stress disorders triggered by the word reform. You didn't just get through the pandemic, you got our country through the pandemic, for which we owe you a debt of gratitude that can be too easily forgotten. You're chronically understaffed, burnt out, and struggling just to keep the show on the road. I do understand the reaction that says, please, no more. But the risk of failing to modernise is that the service will be left to wither on the vine. The NHS fails to secure the advantages of AI and new medicines for its patients, but private healthcare does. The two-tier system that is emerging in our country today grows. The gap between public and private widens, and the NHS becomes the poor man's service. That's the future we must avoid. Instead, we can secure the benefits of the technological revolution for the many, not just the few who can afford to pay. The prize for modernisation is huge. As I came here today, I was doing the media round in Manchester this morning and in Salford, and saw the junior doctors out speaking across the channels. I had this thought. The junior doctors working out there on the picket lines today have never worked in an NHS performing at its best. But many of you have. You know what's possible because you've delivered it before. working with the Labour government to deliver the shortest waiting times and highest patient satisfaction in the NHS's history. You did it before, we can do it again. And despite the obvious challenges, far greater than they were in 1997, if we get this right, working together to put the NHS at the forefront of the revolution in life sciences and medical technology that's unfolding before our eyes, we can say confidently, as the NHS celebrates its 75th anniversary, that the best is yet to come. Thank you. Thank you very much. Thank you.
Very good. Thank you. Thank you, Wes. That was great. You know, I was wondering when you were going to tell us what you really thought about the Tory government. But
I don't understand why I get called a red Tory either.
I don't know.
The passion runs deep to get them out. There we go.
Looking about. Look, we're going to have some roving mics. Have we got some roving mics somewhere? Yes. Yes. My colleagues. Somebody. Anyway, we're going to do that rather than use Slido. And we're going to ask some questions. I've got one question to ask you, which is just about sort of, imagine, right? Imagine first day at post-election, Labour's won, right? Labour's won.
I'm liking this scenario.
Yeah. I thought you might. Labour's won. You're in your office. What are the first three things that you do? What are your first three priorities? As Secretary of State for Health.
That's a really good question and a hard one. Look, I think hopefully, by the time we arrive, a lot of the things that we want to do will not be surprises. We're setting out a kind of reform agenda publicly in terms of our stall, and privately, obviously, we'll have access talks with the department. But and I really hope they nick it by then, if the government hasn't got rolling with the workforce plan, we will be able to run straight away with our commitment to double the number of medical school places, increase nursing and midwifery clinical training places, double the number of district nurses qualifying, 5,000 more health visitors, and so on and so on and so on, which is all part of Labour's workforce plan. It's fully costed, it's fully funded, and we need to get our skates on straight away. I think in terms of my immediate priorities, I think it sort of comes to the heart of what Keir was talking about in the speech in Braintree the other week. I know we've kind of been around this block before about the need for a fundamental shift, the leftward shift, in terms of primary care and primary care access and reform. I just think that is absolutely critical to the mission that we want to deliver. And actually what gives me a great deal of hope is, I think I was actually just talking to Andy Burnham before I came in, take what's going on at the practice in Rusholme, for example. The way in which primary care leaders are working together effectively to achieve primary care at scale, improve patient access, and to provide what looks more like the best of primary care rather than the misery that everyone complains about. I think that is a game changer for patients, but it is also absolutely essential for reducing the pressure that we see in our hospitals. So I think that will be a big plank of our agenda. And then, look, there's no way of tackling the crisis in the NHS that doesn't involve social care. And I think, by the way, and I think it's important to state, especially to an NHS audience, or I think I'll be preaching to the choir here, social care is really important in and of itself, not just in relation to its relationship to the NHS. I think it's an opportunity for social care that so many members of the public understand social care pressures through the prism of delayed discharges and the pressures it's building in our acute hospitals. But it's so much more important than that. And it's not just about geriatric care and the health needs of older people. It's also about the dignity, the freedom, and the quality of life for people of all ages who are disabled and need support to live flourishing and fulfilled lives. The reason why I put that kind of up top, even though it's really, really difficult, is we've been around this block before, and what I have seen under successive governments, Labour and Conservative, are attempts to broach the question of reform of social care and how you pay for it. And they often do it too late. So Andy Burnham tried to convene cross-party talks in 2009, got shot down in flames by the Conservative Party, who used it as a stick to beat the Labour Party with in the 2010 election. David Cameron felt so ashamed about it afterwards, he didn't touch social care apart from the budget, which went down significantly, but later confessed it was his biggest regret that he didn't do social care reform. We saw what happened to Theresa May in the 2017 general election when she floated her idea for social care, and now we're seeing it being long-grasped again and again and again. I actually do believe fundamentally in picking up where we left off in terms of that desire to build real consensus across the system and across the political divide. I think if we don't start that conversation very early in the next Parliament, then we'll be back where every other government has been, and we simply can't afford to do that. The public deserves so much better. The system, both systems, won't cope unless we do, which is why I kind of put that at the top of my list of priorities too.
That's cool. Yes, there's a lady somewhere that has the mic. If you just say who you are and then ask the question.
Hi, I'm Eileen Burns. Thanks very much for your talk, Wes, which I really enjoyed. I've spent my clinical and managerial career in services for older people, so I just wanted to pick up that last point that you made. We know that through last winter, as every winter, older people really bore the brunt of the failures of the health and social care system. They're the ones who, when they fall over in the garden, we see them on the front page of the Daily Mail because the ambulance didn't get to them in time. We've got a number of really good initiatives that are gaining ground, things like urgent community response and virtual wards that give older people options rather than ending up in hospital. When they do end up in hospital, we know that sometimes we can have both ends of the spectrum of ageist care, where people don't get care that would benefit them, and on the other hand, non-frailty attuned care, where people get interventions that maybe aren't in their best interest.
Yep.
So just really interested to know, if you become Secretary of State for Health, how you would address older people in particular, because I firmly believe if we get those services right, we'll solve an awful lot of the problems of the NHS. And some of the things you've talked about, like technology, may help, but not older people are going to be IT literate for some time, in spite of all we do to support them.
Okay, that was a long question.
Good one.
It was a good one. So let's deal with that.
I promise I'll try and be more succinct so we get more questions in. Yeah. In terms of the demographic time bomb we've got, we have to get this right and really and quickly. I was with Alan Johnson in Hull the other day, where they have got provisions so good that it's ended up on Panorama, and for all the right reasons. You know, this is what geriatric care could look like. So we are absolutely in this space of looking at what can be done. In terms of care and dignity and support for people in their own homes, again, both in terms of social care and where we can provide healthcare in people's homes, that's where we're at. That's why when I emphasised the doubling the number of district nurses qualifying, that was about signalling to the system and to the wider public that we think that kind of care in the community is really important. And I also want to send a signal to people who are thinking about their future career in nursing, that district nursing is going to be where it's at. Because you're right, there are lots of people who could stay at home but might need a bit of extra support. And there are actually lots of older people who are quite savvy with technology, as I found when I offered to do the shopping for one of my party members who was very ill, and she waved her iPad at me and said, "You don't need to do that, I've just done it online," and sort of looked at me as if I was daft. So, you know, we shouldn't make assumptions, but you're right, we need to make sure the technology is enabling. I think it's the combination of in-hospital and you know, looking at the whole community hospital settings, but also the support for people at home, enabled by the right team of care around them.
Okay, there's a chap right at the front there. If you could keep your questions fairly brief, because it's important we get as many in. I know that Wes wants to ask as many questions as we can. Yes,
unless they're the difficult ones.
Yeah, well, especially the difficult ones. Yeah, sorry. Keep it going. Thank you. If you could keep
Great,
it
thank you very much. I'm Mark Ricketts. I'm on the ICB as a primary care member in North East London. And I just wanted to hear your thoughts about the idea of having the equivalent of the mental health investment standard, which is sort of mandated must do, having something similar for prevention and something similar for out-of-hospital care, so that that commitment is one that all members of an ICS have to kind of collectively come together to deliver. But actually it is something that is required, and it shapes the sort of financial operating plans.
Okay, good.
Yeah, we're absolutely thinking in that sort of space. We're treading carefully, to be honest, because I'm just really conscious that integrated care systems and ICBs are still fairly new. I've been a bit surprised at the degree to which they've already been asked to change, particularly in relation to headcount. I think when you set up new systems and organisations, you do need to give them time to bed in. And I've tried to provide a degree of certainty and stability by saying, in terms of ICSs and ICBs, our approach will be evolution, not counter-evolution. We're not going to try and unscramble it. We think that actually believe in the direction of travel in terms of more devolution, more integration, more partnership across regions and systems. But look, the fundamental thing I want us all to achieve, throughout the system, the department, NHS England, ICBs, the provider landscape, is that fundamental shift towards prevention, early intervention, early diagnosis, more of a focus on primary care and community services and social care. Because when you compare our healthcare system to others, and I think this is what some of the talking heads miss, the reason the NHS performs less well isn't because it's publicly funded and free at the point of use. It's because you look at where the money goes. Acutes run almost top of the table. Primary care, mental health, community services, capital, diagnostics, we're either near the bottom, at the bottom, or seriously lagging behind in terms of the investment. Now, don't worry, acutes. We're not going to say, all right, first day one of a Labour government, we'll just take a chunk of your budget and shift it elsewhere in the system. That would be a disaster. But I do think over time, we've got to think about where the proportion of funding goes, and also, I'd rather not do compulsion, like the compulsion to work together and the compulsion for integration. But I think if the whole system can lean in that direction, people will do it because they want to, because it works, not because, I've sat there in my ivory tower telling people from central diktat how to do their jobs.
Great. Chat there.
Thank you.
And I've got you in the back.
Thank you. Raghib Ali, I'm an NHS consultant in acute medicine. So I'm very familiar with the challenges that you described, having worked in A&E for many years, and I welcome your commitment to that. But I wanted to ask a question based on my other hat, which is a public health doctor and chief medical officer for Our Future Health, which is going to be the UK's largest health research study ever, particularly focused on prevention. We already have 500,000 volunteers, but we want to get to 5 million. And to be able to show what you've talked about there is how we moved the model from late stage treatment of disease to early intervention, etc. The question really is about the commitment to research. So as Health Secretary in the future, will that commitment, particularly to prevention and public health research, which has been neglected in the past, be there in the future, so that we have an NHS which is not just tackling the demand, but reducing demand for the future?
Got it.
Definitely. On Our Future Health, I'm signing up. I'll help. Just one more candidate for you. I think it's really exciting. I do think it's important, especially when you're the opposition party, and so necessarily you're holding government to account, you're challenging, you're criticising. There are also some great things happening in our country at the moment, and Our Future Health is one of them. And I think one of the consequences of the workforce crisis we're seeing is particularly for people in clinical roles. You've got some of the best scientific minds in the country. By virtue of being consultants, you're very clever people, as I'm regularly told by consultants. And so we've got to make sure, on a serious point, that we free up, your time and space and energy to do that groundbreaking research. Because I think, again, it's one of the massive strengths of our system, is that we can have that kind of applied research, clinically driven, clinically led taking place. But there are lots of barriers and obstacles at the moment which make, and I don't think NHS England would mind me kind of saying this, but they would acknowledge, I think, that the NHS can be quite a difficult partner to work with for people in medtech and life sciences. And we've got to make that easier, which is why I emphasise the importance of fixing the front door to the NHS for them and making it easier. But we've got to deal with the workforce issue, otherwise we'll be being told by clinicians they don't have the time to do the research, and that will only impact on their morale and on retention as well.
Great. I'm going to take questions 3 at a time because I'm going to be told we're running out of time in a minute. And there's a lady right there who you had your hand up first, and I've ignored you, so I want to apologise. If you come to you, right, 3rd line down, 3 across. Yeah. Let's get in there. Get in there. And while you're doing that, following that, we'll take a question from you, and that's 2. And then there's some people right at the back there. Yeah, there's a lady there. Yeah, yes, we've got you. I've got you.
Thank you. And Wes, thank you for a very energising speech. I just want to know, I'm Steph Hood from Hood and Wolf. I just want to know what the Labour government commitment would be to much needed capital investment, and perhaps what your solution for it is, bearing in mind the constraints that we're seeing now and the 120 or so urgent schemes that didn't get onto the 40 new hospitals list, or the 48. Thank you.
Okay, and then the lady right there, yes, got you.
Yeah, hello, I'm Feluke Jaya from Airedale. Really pleased to hear what you're saying around left shift, because we run community and hospital services. But I want to take us beyond that and further back around prevention. So what's the Labour government's approach to cross-government policy development? Because actually we need to look at the wider departments of health. Absolutely. Obesity is a big issue. We've been talking recently about the impact of vaping. We know that the way that we have promotion of unhealthy materials for people to eat is not good, and that could go on housing, the recent tragedy in Rochdale, and so we go on. And actually, if we're going to stem the demand, we really need to go further down in terms of the left shift.
Great, and then the lady that I spotted right there.
That's me. Thanks very much. Rachel Surtees from UCL Partners. I don't think anyone in this room would disagree with the shift towards prevention, but I worry sometimes that it's been hijacked sometimes by an idea that prevention, the reason for that is to dampen demand rather than improve health outcomes and address deep health injustices. And particularly in areas like adolescent mental health where we work, actually if we get that right, we'll see more services, more demand. And I'm interested in the kind of political cover and leadership that you think is needed to recognise that prevention might stimulate, not dampen.
Great, so we've got 3 questions, one on capital. These are all questions I was going to ask you, so you do brilliant, read my mind. One on capital, one on cross-government policy, and the third one on prevention as a means to improvement and get people who need the services into the services rather than just managing them.
Yeah, I'll start off with the one on prevention in terms of cross-government working, because that was really at the heart of what Keir's trying to achieve with the missions he set out, and across all 5 of the missions, because his view as someone who came into politics late in 2015, having run a big public service, and I think Keir is pretty disdainful of politics and the political and the sort of political machinations that impede progress. And part of his analysis is, you've got to get government working together locally and nationally across departments. You've also, if you're serious about achieving big things for a country, you've got to work in partnership with the private sector and the voluntary sector and civil society. And I think that applies particularly in the context of health, the prevention agenda, the social determinants of health, which you outlined in your question. And our approach is going to be health in every policy. And you can start to see some of those green shoots of that coming through. Bridget Phillipson's commitment to have universal primary school breakfast clubs in every primary school is a great support for parents in terms of before school childcare. It's also really a great education and health policy. If every child's starting the day with a nutritious breakfast, they're starting the day with hungry minds, not hungry bellies. And that's great from a health point of view. What else could we have them brushing their teeth at the start of the school day too? Would that be a good dentistry prevention measure? There are lots of things that, and I could give you other examples across, what Lisa Nandy's saying about affordable housing and improving housing standards. All of these things are critical to building a healthier society, and goes to the point Rachel was making too. I accept that, in creating new services, you create new demand. In fact, in our mental health policy, we've sort of actually, I think, given an example of that in that we want to see community mental health hubs in every community and expand IAPS and, into every secondary school. And that's a new service, but it's a critical one, because when I look at mental health cases as a constituency MP, I get young people and their parents in particular coming in to see me to say, I've basically been told we can't access mental health services because the situation's not severe enough. I mean, can you imagine if we went in and said, really sorry, we'd love to help you with that lung cancer, but it's only stage 1. Can you come back when it's stage 4, because we like a challenge? We'd be horrified, but that's what's happening. So we do have to create new services, but I also think there's a crucial point you make as well about the way in which this is framed. we had quite a bit of the protect the NHS messaging during the pandemic, and I totally understand why that was, and I think to a great degree it worked. There's huge public support for the NHS. But the point is that the NHS isn't meant to be there for us to protect it. It is meant to be there to serve, protect and enable us and promote good healthcare as well as to treat illness ideally. And I think we've got to sell the positive benefits of good health and well-being, particularly in the context of an ageing society in terms of our musculoskeletal conditions and some of the long-term challenges, not for the health service, although that's really important, but for us and our quality of life and how we want to live. And that's why, I'll be focused. I'm really serious about being the Secretary of State for Health and Social Care, not just the Secretary of State for the NHS. It's why I spend a lot of time talking to people in life sciences and medtech, of course, but also time sitting around the table with people from food and drink and talking about product formulation and how we can kind of create a regulatory level playing field. So I'm thinking very much in that sort of space. And finally, the hardest question, which I left it till last, is probably the briefest and least satisfactory, I think, if I can be self-critical for a minute. On the capital challenge, I think it's enormous. I don't pretend to have all of the answers at this stage. I am still trying to pick apart precisely what was announced the other week in terms of the projects, the programs, the timescales and the money, all of which I think sound pretty implausible. And there's a lot hanging in the balance. Now, if your whips cross and you've just knocked down a whole load of buildings, you want to know exactly what you're going to be able to deliver and when. If your Leeds General Infirmary with a big mountain of dirt outside that Boris and Rishi turned up with their shovels to for the picture, but it's still a big pile of dirt, at least last time I checked. I think people owe that certainty, stability, and I think we need to understand what the pipeline we are inheriting looks like before we even begin to set out what else we will need to do. So I'm conscious the primary care estate is a challenge, particularly in terms of the shift we want to see. Don't even get me started on the mental health estate. So we are thinking about, reflecting on our successes and our shortcomings when we were in government in terms of capital projects, thinking about where we are today. We're working through it, but I recognise that there is a really big capital challenge, and that's why we're taking time to really get into the weeds of it before we start making promises we can't keep, because I don't want to be the guy that says 40 new hospitals and doesn't deliver them.
Okay. I've just realised we've taken questions from the left, from the centre, none from the right. There's a couple. I'll just take two quick ones for Wes before we close, if I may.
Yes, thank you. My name's Chris Haig. I'm a pharmacist who works in Bolton. Mine's quite brief. It's just, what would a Labour government do to address the current crises in community pharmacy and contractors under huge pressure?
Oh, thank you. You get the prize for the right question. And one more, if there is one more. There's actually, no, I'm afraid you're not on the right centre. Not going to work. The chap there.
I'm delighted to be labelled on the right. It's the first time for everything. Wes, I think you've touched on this a fair bit, but could you just say to what extent you think a Labour government will achieve parity of esteem between mental and physical health?
And your name?
It's Brian Dow from Mental Health UK. I'm also an NHS Assembly member, so very keen to hear.
Got it. You got that, community pharmacy and parity of esteem.
Yeah, I mean, the problem, I think we've challenged the government to do more in relation to community pharmacy and sort of, start to adopt policies that look more like pharmacy first. And the rhetoric's there, and some of the policy drivers are there, but then you kind of see Lloyd's closing pharmacies, and lots of pharmacies I've been in and out of in recent months, kind of doing visits, talking to people on the front line, as it were. It's a pretty difficult time. So I think if we're serious about pharmacy first, we need to think about the activity that we can commission through community pharmacy to make it viable. I think we also need to think about the role that community pharmacy can play on some of the broader prevention agenda, for example. I do wonder if we would be, in fact, I think I know the answer to this. I don't think we would be in a situation where a whole generation of children would be addicted to nicotine if that programme was being managed through community pharmacy rather than through shops popping up on a high street and flogging vapes to kids. or shepherding them out through Snapchat and social media platforms, as is happening with teachers picking up the pieces. So I think there is a role for those highly qualified, highly expert people behind the counter in the pharmacy to take on a bigger load in terms of, you know, supporting and promoting good public health in the community. And, you know, I'm instinctively in favour of that, which is why I've been visiting pharmacies as much as I've been visiting hospitals and GP practices. And finally, on mental and physical health and palliative esteem, I just sort of think we've passed the point, really, of people in my position or positions like it standing up and saying we need it. I think ultimately you will be able to judge whether or not we mean it if the funding goes in that direction, if the focus goes in that direction, and if we start to see outcomes that look more like the ones we would want to see rather than the miserable situation that we've got in our country today. I was really proud of the role that Labour played actually during the passage of the Health and Care Act, championing that shift. We didn't do it alone. There's a coalition, particularly a coalition of quite on some clause of the Health and Care Act, some kind of very unlikely coalitions formed in the House of Lords to see some improvements to that act. But I think that the legal framework is there to see funding shift over time, but we just got to make sure that we follow through on that commitment.
Can you all, I mean, Wes, you've been very generous with your time and you've taken questions and you've been frank and honest with us, and I'm very grateful for that. Can we give Wes a round of applause for
Thank you very much. Thank you.
Thank you. Thank you.